7:30, welcome back to the show. And if you're at the game on Saturday, you know that moment where everything in Williams-Brice went silent. If you maybe weren't watching the play specifically, talking to a friend sitting next to him in the stands, suddenly the silence that went over the entire stadium was deafening, where both teams came out and number 21, Marcus Lattimore, was down for the count and clearly out for presumably the rest of the season and what may or may not be a career-ending injury. Now there's some video right there just after it occurred. His right knee actually taking the injury. On the phone with me, physical therapist Gary Kitchell. 35 years in physical therapy, sports injuries, Gary, as well as over 500 knee reconstruction surgeries. You've been involved with the therapy of getting folks back to normal. Real quickly, can you again just describe what the ligaments do and how they play into the knee?
Good morning, Tyler. Yes. Ligaments are soft tissue structures in the human body that give a joint stability. Primarily, it attaches one bone to another bone.
Mm-hmm. All right. What's the process? Now, we all know what happened. Of course, we're all waiting for updates as to see exactly what's going to happen in Mr. Lattimore's future. What is the recovery process for an injury such as Marcus has sustained over the weekend?
It's multi-stage, especially when there's more than one ligament involved, which this is what it appears to be. Some surgeons just make a determination that they'll repair one ligament, such as the medial collateral first, and then wait a few weeks or even a month to go in and perform the second reconstruction surgeries of the cruciates, the anterior and the posterior, or some surgeons do it all in one setting. Physical therapy begins almost immediately. They get put in a special machine called the CPM, constant passive motion machine, whereby a machine will move Marcus's leg for him so many hours a day. One of the complications of surgery is that your joint becomes immobile. So in one way, surgery is actually an additional trauma to the knee that you have to recover from. So PT begins right away in a very basic motion pattern.
Gary, now, of course, today, folks know, is Marcus's 21st birthday. 21 years old today. What a way to celebrate a birthday.
Yeah.
You know, and he's being looked at, it's no lie, he's being looked at by scouts to go pro. Is it better, if he's going to have an injury like this, is it better that he faces it on his 21st birthday rather than, say, his 31st after he played pro ball for 5 or 6 years?
Oh, for sure. If this was near the end of his 20s or early 30s, it would be career ending. You would not be able to rehab yourself. I think from what I've heard about Marcus being this wonderful, wonderful young man, I think his youth, his attitude, his faith, all factors into his ability to recover and shorten the recovery time.
Fantastic stuff. Of course, we're talking generally just about ligament injuries. We don't know enough yet about Marcus's very specific injury, but physical therapist Gary Kitchell. My friend, thank you for your thoughts and your expert advice on ligament injuries and the recovery time. I appreciate your time this morning via Skype.
Good luck. Thank you.
All right, sir. Very good.